Welcome back to the Doc and Diana Show. I'm Doc. This
I'm
is
Diana.
So Diana has just completed her Prolon 5-day fasting mimicking diet. So, Diana, tell us, what do you think?
I'm glad it's day 6. Actually, it's a great experience. I've gone through it before, and here in a minute we'll get into some questions, from the medical side. But from just layman's side, going through it, it's a great week. It's a great week spent focused on my health. I can tell you the food is fine. The food is great. You get adjusted. You don't really have those major hungers. So it was a good experience. And the best part about it is, even though I know that those 5 days are done, the benefits and the things that it did for my body inside at the cellular level, I'm going to get to reap those benefits for months to come. I know that is still at work, and so I'm really excited that I feel that way even after finishing. So
Absolutely, yeah.
now that I am done, some things that kind of came to mind knowing we had this outlet to get information out, I want to ask you, as patients are coming into Revolution Health and Wellness and you're reviewing their labs perhaps, or they are asking questions and kind of giving you an idea about their life and their symptoms and what they're experiencing, what are some things that you're listening for that kind of trigger you to suggest Prolon to them?
Well, I would say first, anybody with any kind of metabolic derangement, insulin resistance, obesity, those kinds of things are going to be big. And of course, they're very, very common. And in Revolution, we're looking at insulin resistance a little bit differently. We're not waiting until your A1C is 6.1 to say that you have insulin resistance. You can have a fasting blood sugar of 96, which I believe is a little bit elevated. You can even have a normal fasting blood sugar, but your insulin levels are a little bit higher. We're seeing some patterns that are associated with some insulin resistance. Your adiponectin levels are low. All of those things can kind of go with it. And then, have they had an oral glucose tolerance test? I know that gets into another topic, but those kinds of patients, metabolic derangement, having trouble losing weight, some chronic inflammation, all of those patients would be excellent for Prolon.
I'm glad you brought that up because there's a huge long list of benefits associated with Prolon, and I do want to let you know, it's not FDA approved. However, there's a ton of research that has been published that does back the recorded benefits, that people have gone through Prolon and have noticed, and lab results show. And some of that is inflammation, and showing those markers decreasing as they go through that 5 days, as well as you get that heightened insulin, what we would call insulin sensitivity. So
Right.
You start reorganizing those patterns that are deranged and
Right.
and off. As someone who's not medically minded, what are some things that I could be on the lookout for that would suggest I might be insulin, not sensitive, have that
Insulin resistant.
Thank you.
So, obviously, weight gain, difficulty losing weight, it can have to do with some hunger patterns and some cravings.
Hangry.
Hangry.
Okay.
Those kinds of things. But I would argue that really a lot of it is lab evaluation.
Okay.
You may not have specific signs and symptoms outside of doing a forensic evaluation of your lab and your physiology and how are those patterns going. It requires some advanced testing to pick up the really early levels.
And I like that you brought that up because so many of our patients, they come in and I know you have a cardiac patient, a cardiology kind of going through the cardiovascular plan, felt fine. And we see that all the time. Our patients will come in and are like, well, hey doc, I feel great. I love those. My wife told me I had to come,
Right.
so I'm just doing what I'm supposed to. But then we get the lab work back. And when we get the lab work back, it shows us that there's a lot of stuff that is underlying, just under the surface, just kind of waiting for that perfect storm to rear its head. So labs are really important to get that information.
Yep.
So if we've got some things we know it's good for, tell us who you might stay away from and not guide down the Prolon path.
Yeah, so I was thinking about this earlier, and there's really not very many people that I'm real concerned about as long as we have appropriate supervision. The one group or the one category of patient that I would be very concerned about would be anyone on insulin. That could be a type 1 or a type 2 diabetic. It's not that Prolon is really going to necessarily cause a problem, but when you're giving insulin, you're losing the ability to control your blood sugar from a physiologic perspective, and that's what we're trying to get with Prolon. And you're adding insulin on top of that, and you just may not be able to control it, and that could cause some low blood sugars, and it could cause some real problems physiologically. That could be a problem. It's probably my biggest concern and my biggest. Be really careful there.
Okay, and I know that a lot of questions that were kind of given to the office around the time we started promoting, Prolon and stuff, were thyroid patients. So what are your feelings towards a thyroid patient and their ability to feel well and complete Prolon and go down that path for them?
I think the biggest thing with thyroid is really control. If we have a patient that's really out of control, then this is probably not the intervention that we would choose for that patient at that time. So just because someone has hypothyroid and they're on thyroid replacement does not mean that I would not recommend Prolon or a fasting mimicking diet. We've got to get that control first.
Okay, I love that. And guys, this is why you've seen throughout the videos where it is highly recommended that you do this, through your physician, letting your physician know, letting your medical community know that, hey, I'm doing this for 5 days, and just kind of get that final write-off, and that's, definitely a strong suggestion there. So we've covered the thyroid, the insulin, the type 2 diabetics. We kind of know who should and who shouldn't. Now, if I'm a should, how often should I do it?
Yeah, so I would, Prolon has different recommendations based on how metabolically deranged you are. The healthier you are,
loving deranged. Go ahead.
the healthier you are, the less frequent they would argue that you need to use this. And I'll try not to get too deep into the physiology of this here, but when you look at those biochemical pathways and what you're doing with a fasting mimicking diet, you're trying to realign. You're on a different path over here if you're deranged, and we're trying to get you back on an arranged path where it's optimal. So the further the distance, the more intervention it's going to take, the more work it's going to take. So I would recommend across the board, for their sickest patients kind of thing, the people that they recommend the most deranged, they would say once a month for 3 months, and then about once a quarter thereafter. For some patients, they would say once every 6 months thereafter. However, I don't think you're going to cause any problem by increasing the frequency. And I think there's benefit to doing this across the board. That fasting mimicking diet, when you look at calorie restriction, if you can maintain long-term calorie restriction, and I'm talking through the lifespan, you're talking a 30 to 40% increase in longevity. You're increasing lifespan 30 to 40%. So I don't know that you could make an argument that you shouldn't do this more frequently. There's a cost associated with it. There's some inconvenience associated with it, and I think it's a balance of all of those factors
within the lifestyle.
So I would say, to keep it simple, I would say once a month for 3 months as an induction kind of phase, once a quarter or once every 6 months thereafter.
Okay, so I think that's wonderful, and I think that's pretty much kind of covered a majority of the questions that we see on a routine basis anytime that this topic is brought up in the clinic. Of course, if you have any additional questions, feel free to reach out to Revolution Health and Wellness. You can drop us a message there. You can reach us at 918-935-3636. A couple of other things about Prolon specifically. As you're moving and progressing through those 5 days, kind of what is going on physiologically? We talked about lowering the ability for the body to lower inflammation during that process, heightened insulin sensitivity, so we're kind of rearranging those hunger signals and making them much better. So you'll be able to go longer between meals just because you won't have the exactly. Yeah. So that's a couple other things. You also have an increase in what we call growth hormone. So this regenerative repair situation gets to begin at the cellular level. It was brilliantly put to me that when you are undergoing the fasting mimicking diet, Prolon, you are starving the cell, but you are feeding the stomach. So you get to put food in and calories in, but it like doesn't share it with the cells. So so the cells get to clean up.
Right.
Is there a better way you can describe that for anyone?
Well, things like enhanced autophagy.
I love that word.
There's a number of things that it does, and I love to get into this kind of stuff. But usually I get elbowed, and
I'll let you go a little bit, and
so,
then I'll pull you back.
You're talking about enhancing things like mTOR, mammalian targeted rapamycin. You're increasing AMPK. You're balancing NAD and ADH ratios. You're enhancing PI3K pathways and limiting MAP kinase pathways.
Are you kidding?
I told you, but that's the biochemistry that's going on with all of this, and it really does some amazing things at the cellular level. So it's good stuff. We'll continue to promote this at our Tulsa Functional Medicine Clinic. We'll continue to promote calorie restriction, fasting mimicking diets, those kinds of things because of the benefits at the cellular level.
Absolutely. And that's for our patients. We kind of put patients on paths depending on what their labs are. And like you said, it's great for patients across the board, whether they are considered a thyroid patient, a cardiovascular patient. It's just going to benefit them and the goals that they're trying to reach and the needles they're trying to move on their labs. You were throwing out a bunch of your acronyms and things that are going on that basically we could summarize in saying anti-inflammatory, anti-aging, and those kind of buzzwords. And another buzzword is stem cell. So
Right.
When you're undergoing the fasting mimicking diet, you're also increasing that stem cell generation, which means you've got new baby cells in there that are ready to take on the jobs of those that are aging out of the process.
Right.
So you just get a whole robust amount of activity that's going on it's phenomenal. And like I said, even past the 5 days, those activities are still ramped up.
Right.
And moving in those directions. So you get benefit long past that last L-bar or soup
Right.
that you're getting
Right.
to put in. All right. So anything else that you think that we need to cover for Prolon, other than we got a transition diet on day 6. Day 7 is brilliantly placed for you to move into your nutritional landscape of choice, whatever that is.
And that was exactly what I was going to say.
Okay.
This is not something that I would say you do 5 days out of the month for the first 3 months. And you do 5 days out of the month, and then you go back to McDonald's for the rest of the month, and you're good. I think if you're going to eat McDonald's, then you have to do something like this in order to help
counter.
Exactly. Truly,
Yeah.
The amount of inflammatory, oxidative stress load that you're enhancing with a traditional, typical standard American diet, is overwhelming, truly. And if you're going to do something like this, then I think this is a great segue to having a good nutritional approach the other 25 days of the month, and that's what I would recommend. That was what I was going to say. So you hit the
Perfect.
nail on the head there.
Perfect. And also another concept that we carry at Revolution Health, Tulsa Functional Medicine, is we also strongly encourage you to get a package with myself, with a functional medicine life health coach, because of that added support that you need, plus helping to define what is that nutritional landscape once I hit day 7. What has my doctor recommended, my provider recommended, and how am I going to apply that? And that's where I come in to kind of help with all of the logistics of what you are going to choose for food and how we're going to prepare that, and how to get it organized, shopping, etc. The whole thing.
Yeah, you do a fantastic job with our patients. I kind of think that before patients come see me, they should probably come in and see you. Almost do a course of one of the packages. Get started with those things, because those issues, those topics are so fundamental to improving health across the spectrum, whether it's cardiovascular and diabetes and thyroid and all of those kinds of things. And obviously there's medical issues that come up, and we can certainly address those, but I just think that exactly what Diana said about getting a a health coach that can guide you through this process and help you and give you accountability and all of those kinds of things. It's incredibly invaluable, cost effective, and beneficial.
All right, guys, make sure you like this video, you share it with someone, and what else are they supposed to do? Subscribe?
Yep, subscribe, like, check out our website for more stuff, look at our YouTube channel for more stuff, and let us know how we can help you.
Absolutely.
Thanks.